Have you ever noticed milk or milky discharge coming out of your breast, one or both breasts, even though you're not pregnant or breastfeeding? And you have wondered, is it that I am secretly pregnant, or I have breast cancer? Or is there something else that I do not know about? Okay, let's talk about it. The production of breast milk from a woman who is not pregnant or breastfeeding is called galactorrhea. Galactorrhea is on its own not a disease, but it may be a pointer that something is stimulating breast milk production. So the discharge from the breast could be milky, it could be white, it may be from both breasts or just one breast. It may also occur without the breast being squeezed or only when the breast is squeezed. So some common causes of galactorrhea include high prolactin levels, usually called hyperprolactinemia. Prolactin is the hormone that is responsible for breast milk production. So when you have high levels of prolactin, there will definitely be increased breast milk production. Some conditions that will cause this are some medical illnesses. When there is some imbalance in the hormone regulation, this could result in high prolactin levels. It is one of the commonest causes of galactorrhea. Another thing that could cause galactorrhea are medications. Some medications like anticonvulsants, antidepressants, even antihypertensives that are used for the control of blood pressure could cause galactorrhea as their side effect. Some pain medications are also implicated in this. Another thing is pituitary tumors. The pituitary gland is the gland that is responsible for production of prolactin, which is a hormone that produces breast milk, like we had earlier said. When there is a tumor of the pituitary gland, there's increased prolactin levels and, by implication, increased breast milk production. Some symptoms that will be seen will be increased breast milk production. There could also be irregular periods. There could be reduced libido. Some people will complain of blurred vision or blurring of their vision. There could be headaches, okay, depending on the size of the tumor. But the good thing about these are that most of the prolactinomas, which are tumors that produce prolactin, most of them can be effectively treated with medications. Other things that can cause breast discharge are hyperthyroidism. When the thyroid gland is hypoactive, it can actually cause stimulation of prolactin production, which will result in increased breast discharge. The other things are breast stimulation, breast or nipple stimulation. When the breast or the nipple is continually being or repeatedly being stimulated, it could result in increased prolactin production that eventually leads to production of breast milk. In some instances, like wearing of tight clothes that cause friction, sexual stimulation, or even stimulating the breast by trying to press on it to check for if it is producing milk, that can actually stimulate the breast, leading to production of prolactin and then consequently production of breast milk. Stress is another factor that can cause this condition. So both physical and emotional stress can cause increased prolactin level that can result in breast milk production. But it's important to note that stress on its own cannot cause it, but it can contribute to this condition. Other things like liver disease, chronic kidney disease have also been implicated as causes for this condition. Not forgetting pregnancy. Of course, in pregnancy, the changes in the hormones and increased prolactin level in preparation for the forthcoming baby also can cause breast milk production. Breast cancer can also cause breast discharge, which is usually not milky. Well, it may be milky, but sometimes may be bloody, foul smelling. So you should see your healthcare provider if you have breast milk that is persistent and you're not pregnant, if you have breast milk discharge from only one breast, or if the breast milk is bloody or offensive, if you also have irregular periods with breast milk discharge, or you notice blurring of your vision or persistent headache, all of these should necessitate your visit to a doctor or your healthcare provider. Some things you should avoid are avoid squeezing your nipples to check for breast milk. Avoid taking herbal medications. Don't assume that because you have breast discharge, it is cancer. Do not ignore the fact that you have breast discharge without pregnancy. So what are the key takeaways from this discussion? Breast milk production when you're not pregnant is called galactorrhea. It is usually caused by elevated prolactin levels, and some medications, some medical conditions can cause this, including nipple stimulation. Pregnancy should always be ruled out. Persistent or unusual breast discharge should be assessed by a qualified healthcare provider. I hope this video has helped you to understand why breast milk can sometimes be produced even when you're not pregnant. If you found this video helpful, please like, share, and subscribe to the Obstetrician's View for more evidence-based discussion on women's health and pregnancy. And don't forget to share with someone who may benefit from this video. If you have questions or topics you would like us to discuss, please drop them in the comments below. Thank you for watching. I'll see you in the next video.